Thank you very much. Thank you for the opportunity to present today. As Maurice said, my name is Shakila. It's the first time I'm actually presenting at this conference, and thus far I've really enjoyed all of the presentations. So thank you for that opportunity. Today, I'd really like to talk about a project that we did at the Center for Augmentative and Alternative Communication, where we looked at the involvement of persons with complex communication needs and other stakeholders in the co-design of health information materials. I'll give you a bit of background about the project. This was basically the team. You'll see there were quite a few people involved in the project, and I actually want to just acknowledge them. We also had youth with disabilities on the project who worked as consultants and assisted us in this project. So when we got some of this funding, which was actually from UNICEF, one of the people part of this particular webinar or congress, we wanted to really develop materials that were kind of co-developed with people with disabilities and with families. It was initially really around looking at where the people with disabilities, what their needs were in response to the COVID pandemic. But in looking at that work, we realized that there was much more that needed to be done in terms of access to health systems for people who have complex communication needs. So in this project, we asked people or youth with disabilities about their experiences. We also spoke to family members as well as healthcare professionals. And hopefully, if time permits, I'll give you a synthesis of all of the findings of this particular project. So what we do know is that access to appropriate and quality healthcare is a constitutional right granted to all persons in South Africa. However, accessible and understandable health information is rather limited. There are issues related to the format of the language, the modalities of language, and the type of information that's actually provided. This reduces the quality of healthcare and usually negatively affects healthcare outcomes for these groups. The COVID-19 pandemic once again highlighted these systematic inequities, and I think this has been highlighted also in the more recent literature. So what we do know is that when people with disabilities or youth with complex communication needs are involved in healthcare, we know that there's improved medication and treatment adherence. There's a decreased need for very sedation in terms of ICU. So what we do realize is that it's actually really important in terms of providing quality health care. The goals of this project, as I said earlier, was really to understand how youth in South Africa obtain health information, and also to understand some of the challenges that they experience in terms of gaining some of this information. When we embarked on the project, we thought we needed to really visit what are some of the co-design principles when we look at designing accessible health information. And there were a few models that were available, for example, the model by Park. And in this model, what it tries to show is that the researchers and the professionals really have to work from the perspective that people with disabilities have something to contribute in terms of producing a health education material or really contributing to their own care. So that is kind of the stance that we really need to be starting at. And we try to inculcate that into our project as well. Then there was a more recent model for those of you that are interested, that was by Smits et al., that really talks about how do you go about involvement of youth with disabilities, any persons that you are working with into our project, so that it's not so focused or researcher run, but really responding to the needs of people in a more collaborative way and hopefully in a more equal way in terms of that partnership. So what this particular model does is it forces you to think a little bit about what is the role of the people that you are involving in the project. Are they really listeners where they're just giving you information? Are they co-thinkers in that they give you an opinion? Are they advisors? Are they partners, or are they decision makers? And this is what drove, or was what the model was that drove our development of this health education materials. I think it's, it was some of the aspects we think we are doing in our work, but, we had to ask some really critical questions in terms of how we were engaging with youth with disabilities and how we were exercising our research agenda in a sense. So if we look at the synthesis of the findings from the interviews with youth with communication disabilities, these are some of the things that we found. So this is basically a reflection, and I hope you'll be able to hear it, from Ms. Constance Intuli, who was actually a person with who uses AAC. She works at the center as a disability advocate, and she basically had some ideas to share.
Here are some of my bullets that I found very interesting. When I visit the hospital and clinic, part people have different attitudes towards people with disability. While some are helpful, many don't know how to communicate with a person.
Sorry, I think that got cut off, but basically these are some of the bullet points. She's a mother of 2 children, and she spoke quite frankly about some of the challenges she experienced in terms of accessing healthcare. Some of it were attitudinal, and some of it may have been related to the way she was treated and the way information was provided to her. So these were the kind of information we were getting from various people who use AAC in terms of accessing hospitals. We also interviewed them about some in different methods. We had WhatsApp groups, online surveys, and we asked them in various ways to give choices, to give their input in terms of how we were designing some of these health education materials. We also asked them about how they obtain information, what are the challenges they observe when they access the healthcare facilities, and what are some of the things that they would like more help with. And you can see the training of medical professionals came out quite strongly from the perspectives of these youth. We also spoke to them about what do they think about the symbols, because I think we often talk about pictures and symbols, and yes, these are things you need to train on, but we also wanted to try and get a context in terms of what was meaningful, what may require less training when people are looking at some of the pictures that we were going to be developing. We also had an artist assist us with some of these so that it could actually, be modified so that it could be a little bit more meaningful. So what we saw is that a lot of them preferred pictures that were kind of not so, without a meaning, etc. They wanted something that represented them in some way and kind of explained meaning. And there was consensus generally among the people about what conveyed meaning and in what way. So some of these, things we had to take into as well. For example, we started off with symbols that are, quite widely used, and we finished with something like this. So these are kind of the things we needed to think about in terms of the appropriateness for the population that we were working with. We also spoke to different professionals. We did online asynchronous focus groups, and we asked them, some of the healthcare professionals, what were the challenges that they were experiencing in terms of delivering or accessing healthcare information, and what were some of the resource needs. So what would they find useful in their day-to-day practice? So this is a summary of what some of the strategies were. They said it's important to train other healthcare professionals to focus on strategies that help with expression, but also comprehension of some of the healthcare procedures that people were going to be involved with, as well as engaging in different activities. So this is just a summary of some of the ideas that they gave us in terms of what we needed to focus on, general information, not only related to COVID, with regards to enhancing access to healthcare. They also provided some ideas on what are the resources that they wanted us to focus on as well. And, for example, electronic resources, storyboards, videos in different languages. As you know, for example, in South Africa, we have at least 11 or 12 official languages. So the ability to get this information across in multiple languages and modalities was highlighted. We also spoke to caregivers of youth with disabilities, and we asked them what were some of the challenges they experienced as parents or as caregivers in terms of accessing healthcare. This was the group. We had about 6 caregivers, and some of the demographic information about these caregivers is highlighted in this slide. So they highlighted basically that children are basically given very little information. It is usually driven by parents, and that information targeted at the general public doesn't always take into cognizance what children's needs are, and that parents really have to resort to their own strategies to support their children in understanding health information. They spoke also about, in terms of COVID, they found that it was difficult to explain some information to children with disabilities, and also that it had to be driven by parents. There was very little information that was targeted at giving children information in a way that was meaningful or understandable to them. They talked about broad procedures that they thought needed some information or support to better prepare children to access healthcare. And these are simple things, not really related only to COVID-19. They also spoke again about the importance of training professionals, healthcare professionals, and some of the things that they needed to do in terms of treating people with disabilities the same as others, and also making sure that you talk to the child, etc. So some of the basic things that they felt that could be trained, and some of the negative experiences that they were having in the healthcare setting. They highlighted to us also some of the needs and what would be helpful to them. So in essence, what we did is took all of this information from the various perspectives, and we tried to come up with a whole lot of materials that could be helped and could be used by various stakeholders. These informations, or this repertoire of materials, is available on our website. It's obviously for free. We developed 18 communication boards, 20 visual scenes, 72 social stories in 6 South African languages. And these are, downloadable. We also considered things like data, etc., so that it's relevant to the South African context, messages that people could easily send to each other via WhatsApp, or media that could be useful. And this is basically a list of all that we have developed over time. This is just an example of a board that we developed for this project in collaboration with the stakeholders. If this video will play, I'll just play a short snippet of it. And this is just an example of a simple story that explains how to communicate with a healthcare professional. So I'll just play this for a second.
How to communicate with healthcare professionals. Ahead. Prepare by storing information and questions in your AAC device or on paper. Ask for help. Ask your communication partner to help you. Don't rush. Allow for plenty of time and stay calm. Hello. Greet the doctor or nurse. It will help to start the conversation. Use what you need. Use everything you need to be able to communicate your questions and information. Use your hands, your voice, writing, pictures, and your communication device. Goodbye. If you still have questions or want more information, book another appointment before you leave.
So those are just some of the examples of what we developed. There are others that explain different disabilities, because youth said, they always don't understand what disability they have, what is cerebral palsy, etc. So, we had to develop some of those as well. And then also materials for healthcare professionals in terms of how to communicate with a person who uses AAC and is accessing accessing services at your clinic. So those are just some of the examples that we have. We also have all of this available on our website. I know it's not available in all of the languages, but perhaps some of it will be useful to some of you that are, working in these settings as a starter or an idea to develop some more materials. We also published some of this work. You're welcome to read these. The one on the involvement matrix is open access, so that shouldn't be difficult for you to get. And basically, these are some of the references that we have. I've left time for Q&A because I will not be available later on this afternoon. So Maurice, I think that brings me to the end of my presentation.